restrictions today that you've announced, they are pretty much effectively a lockdown. So why don't you just go all the way, shut schools, call it a lockdown, the way other countries around the world are doing in order to reduce the number of local transmissions?
People use the word lockdown very loosely these days, and it means many things to different people. We like to think of our strategies in different categories and based on risk. At the very baseline level, there are things that we ought to do permanently. And even after COVID-19 is over, and it will be over at some stage, we have to maintain these standards. For example, things like washing our hands regularly, not using your hands to touch your face. These are all things that better public hygiene standards. These are all things that we think are important. Baseline, permanent changes. That's why we launched an SG Clean campaign. And even after COVID-19, these practices will be useful for countering any other infectious diseases as well. Beyond the baseline, we are talking about a range of, a series of measures that can be put in place throughout, or precautionary measures that can be triggered, as we say, additional breaks as and when the need arises. So we announced a series of measures last Friday around large-scale gatherings for F&B outlets to have separated seating. That's the next level of risk, and that's the next level of precautionary measures which we have introduced. Now we are putting in place a third category, or higher category, of additional precautions, including limiting gatherings to less than 10, and even closing some of these venues where we think social gatherings are likely to be concentrated. We've said that these measures will be put in place for a month. And if these measures are effective for a month and it helps to break potential transmission chains, we may then come back to Tier 2, where we were last Friday. If these measures are not effective, we may continue them for another month. We could escalate further. Escalating further would then go into the next level of measures, which would include suspension of schools and workplaces. They have to go together, because there's no point talking about, you can close a school, but people need to look after children. And if parents are working, then very hard for them to look after the children, and the children will be running around anyway in the community. So closure of schools, closure of workplaces other than essential activities, that's the most drastic step, if you will. That's what I suppose people call a lockdown. And that set of drastic measures may well be necessary, but again, we do not have to get there in one step. We can take a series of breaks, and then if the situation warrants it, then we may very well, at a later stage, we may very well have to do that. That's why we are urging all Singaporeans to take these measures seriously. If we do these steps well, then we may be able to get through this current very critical time of the infection cycle, where we are seeing a rise in imported cases, a very large wave of imported cases, and very real risk of local transmission happening. It has not happened yet in a widespread manner, and so all of these measures are really preemptive. And that perhaps is a bit of the challenge we have in getting people to take it seriously. In many countries, the very drastic measures have occurred after a widespread outbreak, thousands of cases or tens of thousands of cases. We are not there, and so perhaps there is a certain sense of things are okay in Singapore, but the risks are very real, and that's what we are trying to highlight, and that's why everyone needs to take these measures seriously, and it's only with everyone, if all of us do our part, that's the only way where we can have a chance of success with these strategies.